Welcome to the HealthSpark, Igniting Healthcare Management Change and Evolution. I'm your host, Dr. Raya. Hi, I'm Dr. Raya on the HealthSpark, and today we have Rebecca Gonzales. She's the Chief Customer Officer with Cantellus Group. So welcome, Rebecca.
Hi, thanks. Thanks for having me.
So, Rebecca, tell us a little bit about yourself. Tell us your story, which is super fascinating. We're really interested in learning more about you.
Absolutely. So I am a Latina, a Chicana, born and raised outside of Corpus Christi, Texas. I spent a majority of my adult life in Texas. I graduated from high school in Corpus Christi at Mary Carroll High School. Go Tigers!
Oh.
And then I went to school up in Dallas at Southern Methodist University. I studied journalism, and that was my plan. I was going to be a journalist, and I was going to expose all the harms and right all the wrongs, all those very, very typical big ideas and big dreams we have when we're teenagers. So I got a BA at SMU and did start living my dream. I went off and I worked at a radio station. I worked at an NPR station doing the morning news. Then I went to TV and I was working as a producer and a desk manager at a CBS affiliate in Austin. I was doing all of those things that I thought I wanted to do. And then I kind of hit a wall and I said, this is not what I expected. I am not changing the world, and I'm not doing all these things and writing the hard stories. And the realities of, the real world started to set in. And I started to take an interest in technology. And we had a computer and an internet connection in the newsroom, which was a big deal at the time in the early 90s. And I started to really be interested in technology and what technology meant for our lives as human beings. And so I started. I answered an ad in the paper again back in the back in the dark ages. I answered an ad in the paper for an editor for a website. And this was exciting because there was not a lot of web companies in Texas. Mm-hmm. So I went to work at a company called City Search as an editor, because if there's one thing that I knew how to do, it was write. So they needed editors to create content for this website, which was the first, if you think about like what to do and where to go, and a city guide really was what City Search was. And so I did that. At that job, I learned so much about technology. I mean, things that I'd been working on computers, it was not a big deal, but the internet and what the internet meant to us and what we could do and create. From then on, I took different jobs with different startups and different hardware and software companies throughout my 30-year career in technology. But what I always found myself, and where I always found myself, was really connecting with my roots and what I did as a child. So as a child growing up in a Latino family in South Texas, we did a lot of translating for our grandparents, for our abuelas, our abuelos, translating documents, translating mail, just reading through and telling them what it meant in Spanish. My education in Spanish is not professional education in any way. I don't even think I took a Spanish class, but we grew up speaking Spanish, right? So I was translating and I was working in Spanish and English. And when I got in technology, I found the roles that I kept taking were translating what the technology meant to actually what the user benefits were. What benefits were you going to get if you used our computer? What benefits were you going to get if you used our chipset or our software? Right. And there was people that weren't doing that. And I was working at a startup, and I will never forget, we had a big client that wanted to do something with our website. But what they wanted to do was not technically possible. So we had the salespeople asking questions, we had the marketing people asking questions, we had the customer asking questions. And I said, where's the technology people? Where are the engineers? And they were like, oh, we didn't think we needed them for this conversation. So I said, let me take this back to them. So I took the customer requirements. I went back to our engineers and I said, I'm pretty sure this can't be done, but tell me, am I wrong or right? So I started learning so much more about the technology and really seeing the value in taking that, what I could do, which was speak in a common approachable language,
Yeah.
and I could take those technologies and make them real. Like it wasn't just, how fast it goes or how much memory or how much storage you have. It was, here's what you can do with this. And so really, that's when my career took a very different turn, and I started managing alliances, and I started managing partners, because I would help them understand our technology and take this technology and sell it and make something of it, right? So I did that for many years. And then I was starting to look into, I was in consulting at the time, and I was looking into big data.
Mhm.
And all of these customers had all this data, and what were they doing with it? What insights were they getting from it? And the answer was not a lot,
Yeah.
right? So we were looking at this, and so I started a little practice where we were doing big data projects, and I sat with these data scientists and I said, what's next? Like, this seems great. We're getting some good insights, but I know there's something coming. And they said, well, it's called artificial intelligence. And I said, tell me more about that. So as I started delving into artificial intelligence, this was about 2016. And by the way, artificial intelligence has been around for like 60 years at this point. It's
Wow.
nothing new. But there was, because with all technologies, right, they have those adoption and those drop offs. AI kind of went through what they called the AI winter back in the 1980s, where people were just too afraid because it was moving so quickly. And they kind of put the stops on it a little bit. So artificial intelligence was first used in the scientific community in the 50s. So not new, but definitely the applications are new. So I'm looking into AI, and I'm starting to work with customers and say, I've already done this big data project for you, right? We've taken your data, we've gotten insights, we've helped you improve your products, but have you thought about artificial intelligence? And everyone was like, whoa, okay, that's an interesting idea. Let's talk about it. Well, this is when our friends at Amazon Web Services came knocking, and they offered me a job in their partner organization around artificial intelligence. And it was light on the artificial intelligence side. It was mostly on the cloud. And I said, I don't think I want to do that. I said, I've been there, I've been doing partners and alliances. I'm really interested in artificial intelligence. And the hiring manager was someone that I knew. And she said, Rebecca, help me start this team and give me 9 months. And after that 9 months, you can go do whatever you want in Amazon and Amazon Web Services. She said, because if you really want to grow your AI, where better to do it? And I said, okay. So I went to work with her at Amazon, and I quickly transitioned into an AI role where I was helping our partners understand, again, using my translation to
Wow.
understand how to use our AI tools, which we were developing,
Mhm.
into their businesses. So in November of 2023, our world was rocked by the announcement of ChatGPT. Now, we all knew it was coming, but there's something powerful about getting that new technology on your phone,
Yeah.
right? ChatGPT was launched. You could ask it any question. Now, we can have a deep conversation about if those were right or wrong and what has happened since. But because at Amazon, we were already looking into generative AI as well, once that launch happened, sped everything else up, and they switched my team, which I was on a team working on responsible AI. So again, aligning my passions on how we take technology and how we grow and how we help people. I had started to help customers use AI in a responsible way. And we'll talk a little bit about that
Yes,
as well.
please.
So they switched us over to being a generative AI innovation center. And again, I started to help our salespeople talk about this new technology. So that was about my 5th year at Amazon, and I decided it was time for new horizons. I was really, really interested in continuing my work on responsible AI.
Yeah.
So that's when I called my current CEO at the Cantellus Group, and I said, hey, I hear you're growing. I hear you're doing some great things. I'm about to leave Amazon, so can I join you? And luckily for me, she said yes. And that was a little bit complicated by the fact my husband and I had decided we were moving to Lisbon, Portugal. And I said, oh, and by the way, I'm moving to Europe. I hope that's okay. And she said, no, that sounds great. So I joined the Cantellus Group back in March. We're a small consulting firm. And really what we do is exactly what I started to do at Amazon is we help our customers use this technology in a way that meets their business objectives, but also does it in a responsible way that does not introduce any more harm or bias. And we'll talk a little bit about both of those things into society. And so I'm super excited to be talking to you. Healthcare is one of the things I'm super passionate about. And I've had lots of conversations with healthcare professionals around artificial intelligence.
Yeah.
And I'm super excited to share that with you.
Well, and can we start with the
Yeah,
level set for the
yeah, of
audience
course.
and myself? Technically, what is generative AI? Because I know there's a lot of different AIs, right? So
Yeah,
what is generative
absolutely.
AI to level set for everybody?
Yeah. So let's start like real basic, right? So artificial intelligence is an umbrella term, right? Everything generative AI, machine learning, deep learning, all of those things are subsets of artificial
Ah,
intelligence.
okay.
To break it down, artificial intelligence is basically a science where machines, computers, can replicate and augment human activities,
Mm,
right? So we would be, if computers are artificial intelligence, we would say maybe we're real intelligence, right? So we think, we come up with these things, and this is a big a kind of an issue that I'm pretty passionate about. When we talk about these machines, we need to acknowledge that they are machines. They're algorithms, they're computers, they're not human. They
right.
don't think, they don't reason, they don't come up with new ideas on their own. They take the data that we give them and give us outcomes.
Okay.
So artificial intelligence is that overarching. Machine learning is where you program a model, or sometimes it's called an algorithm, to give you a certain outcome. So you put your data into the algorithm, you say, these are my sales for last year with, in all my products, you put in as much information as you want. You tell the algorithm, I would like you to predict based on past data what my bestseller is going to be next year. And you program the model and it takes the data and it gives you a specific outcome. It's a
Mm,
very one-to-one outcome.
okay.
Okay. So each model gives you one outcome.
Okay.
So then we talk about generative AI. So what generative AI does that's a little bit different is it's kind of like a one model to rule them all, right? So it's a foundation model that's in the center, and that foundation model can be programmed with unclean data, with data that's not really necessarily cleaned and ready.
Mm,
It can take that data and generate a new text, a new output, a new context.
mm,
So it's creating something different. So that's the generative part, right? So you put things in. This is how people are able to put images in and create a video, right?
okay.
And that model can be used for multi-purpose things. Some models are better than others. Some models are better for creating video. Other models are better for creating print or text or documentation.
Mm,
It all depends on how the model is trained.
okay.
So the difference in that foundation model is it is trained on copious amounts of data. If you look at foundation model or foundation model providers, there are not very many. There's a handful of them, and they're all big companies. And the reason is these foundation models need so much data. The average company doesn't have access to that much data to program this foundation model to be the basis of
Okay.
this progress.
Okay.
You'll also hear LLM, which stands for large language model. That's part of generative AI. That large language model sits on top of the foundation model, and it really focuses on the L, on language, right? So language learning, language processing. We already use something like a large language model when we're texting. If you are texting on your Apple device
Okay.
and it gives you the next word, that predictive text, or it spells the word right for you, that was a very, I would say, beta version
Mm,
of generative AI,
I
because
see.
now these generative AI models are so much larger, they can produce so much more.
I see. Okay, great, great.
That
Okay,
makes
so now
sense?
the next question is the responsible question. So what is
Yes.
responsible AI?
Yeah, absolutely. So because these models are fed in data and they make predictions off this data, bias is everywhere. So as a human being, we have both implicit and subconscious bias, right? I have a bias for purple shirts over green shirts. Like that's a bias. Now, is that bias harming anybody? Probably not. Is that bias out in society? Probably not, right? So the biases, not all bias is bad,
Right.
right? But when you bring bias into an algorithm or a generative AI system, it is amplified and it can cause more harm out in society. I'll give you some specific examples. So, for example, if there's bias in your financial data and you apply for a loan, that loan that you apply for is going to take all your personal data. It's going to run it in this algorithm. This algorithm might have bias against people from your zip code. It might say, oh, people from that zip code don't pay their bills, right?
Right.
And this is just a piece of data. It's not meant to get an outcome from that piece of data, but the algorithm uses it and it promotes that bias. That bias might not be true, but the bias is programmed into the algorithm. And then the algorithm says, oh, well, you live in that zip code. And even if you make the right amount of money, even if you have a great job, even if you have a perfectly spotless record, that one piece of data, the bias in that one data might keep you from getting a loan.
Mm.
So when you put in responsibility or an accountability around AI, you try to mitigate those biases because, as I mentioned, you're never going to get rid of the bias. It's almost impossible.
Right.
But what you can do is you can mitigate it. You can program around it. You can make sure that when your model is making a decision, it doesn't use zip code as a proxy for racism or a zip code as a proxy for any other bias that might be inherent in the data, right? So it's super important for people that are using data and deciding what data is going into these models that they understand their data, right? You understand that there's bias in that data, so you can work around it.
Okay.
Where people make a mistake is they assume there is no data. There is no bias in that data.
Right.
And so they don't plan for it. So when you use technology responsibly, be it AI or whatever technology is going to roll down the pipe in the next 6 to 8 months, right? You are actively choosing not to perpetuate biases, especially harmful ones. You're actively choosing to ensure that you lessen the harms and the negative impacts on the community, on your customers, whoever you choose that's going to be impacted by your AI models. So there's tons of frameworks. I'm happy to share resources with you that you can share with the audience.
Love that.
But the thing is, it's all about different frameworks use different names for it. I call it transparency.
Okay.
Some people call it explainability.
Okay.
So transparency and accountability for me are the keystones of how to do responsible AI. Okay. So transparency means you can explain why your model came up with that output.
Okay.
You would be surprised the number of people that use AI that cannot tell you why their model made that decision, right? So this is what a lot of the upcoming regulation is talking about. It's talking about transparency. So what regulations are saying is you, company A, can use AI all you want. But when someone comes back and says, back to our loan example, why did you deny me that loan? Right. You can say, my AI made those decisions because of these reasons, right? It's happening in healthcare as well.
Okay.
Why did you deny me coverage? Why did you deny my claim? You have to be able to look, if you are not understanding how your models are coming out with these outputs, it will be a problem because you need to explain to customers, regulators, the board, like everyone is going to ask, why is your AI coming out with these outcomes? Because it's not making them up. It is coming up, you're adding the parameters and you're telling it how to make these decisions, right? So we like to say, what another thing that's important around transparency is human-centered design. So if humans aren't involved in your design, you're going to have a problem. You need to make sure that the humans, not only the humans programming, but the humans that are getting impacted by your AI understand how it's being used, right? And so you have a human, I like to say, computers make predictions and humans make decisions. Right. So when these things make decisions, especially when we can talk about healthcare, it's super important for the humans that are employing those AI to be able to explain why those things are happening. And then accountability. So accountability is who's responsible, right? There was a really famous case that just happened, a couple of months ago, with the Canada Air. It's the airline provider in Canada. and they
Okay.
had a chatbot, and the chatbot using generative AI gave the customer a wrong answer about bereavement fares. Okay.
Wow.
So the guy was very smart. This is a good lesson to learn. He documented everything. So he was chatting with the chatbot on his phone. He was taking screenshots. He said, I've had a death in the family. I need to travel. What are your policies for bereavement fares? And they said, take this, book the flight, take the flight, and when you're back, send us the receipt, and we will give you so much off, like a discount or something. I don't even think they were saying it was free. Well, when he did that, the live human that he was interacting with said, "Oh no, that's not our policy." And he said, "But your chatbot told me that this was your policy." And they said, "We don't know where that chatbot got that information," which is wild because the chatbot was trained on their own data.
Right.
And he took him to court. He
Wow.
said, "Your chatbot said this, and it was wrong. So you still owe me. This chatbot is part of your company." Well, to Canada Air argued that the chatbot was an independent legal entity.
Oh my goodness.
And the judge said, no, it's not.
Wow.
So there's all these cases that are happening, especially in places like Canada, where they have like it's kind of like a what we would call a small claim court in the United States, but you can take anybody to court in that specific. So this is some of the case law that's happening right now that's going to impact everyone around the world, because obviously that's precedent in Canada, but still
Right.
this is something where it's telling companies that you are responsible for the outputs of your chatbots, especially when they're talking directly to your customers.
Right. Right. Okay. So you said that there was some, I mean, you do healthcare work right now, right? With AI.
Mhm.
And so are there any case studies or anything that we can learn from as far as examples of, or maybe bad examples of people using
Absolutely.
for healthcare?
Absolutely. So, healthcare, life sciences, pharmaceutical companies already are using a ton of AI
Okay.
for really, really good things, right? So, the top two, three things that I can think of for healthcare is drug discovery,
Okay. Okay.
accelerated development of those drugs, and approvals, right? So those are already things that are going fast with AI,
Okay.
because when you're just doing those things like drug discovery, all of the things that you would have that would take a really long time to go through the data, to sift through the data, you can use AI to write those reports to get those outcomes way quicker,
Okay.
right?
Awesome.
There's already some very basic things that can be used, AI can be used for on the positive side, are business efficiencies on these technologies,
Okay.
right? Note taking, reports,
Mm.
summaries, things like this that are administrative, email, like all of these things, AI can help you get through those a lot quicker.
Okay.
Now, there are challenges that we've talked about, especially with the availability and the usability of data and the documentation and the ethical considerations. Because in healthcare, you're dealing with live human
Right.
beings, right? It's not just cases. And I can tell you that when generative AI first came around, the companies I worked for and a lot of companies in the industry said right off the bat, generative AI is too new, and we will not allow our generative AI tools to be used when you're making live decisions about patient care.
Right.
Right. Talk about a place where we don't want a computer interfering, right? Especially when it's a doctor and a patient, right? We don't want computers in the way of that.
Right.
Now, unfortunately, we have also had some negative impacts from AI around patient care and provisional and providing patients care. So we talked a little bit about earlier that these data algorithms can reinforce these inequities and these inequalities.
Right.
Very recently, like in the past 6 months, there was a article written about the fact that generative AI models like Claude and ChatGPT were actually answering questions about patients and about pain, and really perpetrating those old horrible narratives that people of African descent do not experience pain the same way that people of other ethnicities. And this was very recently that when asked, these models were spewing that same incorrect information.
Wow.
So as much as we're trying to get those biases and that horrible information out of healthcare, these models were actually saying, yeah, that's true. They experience pain differently, which is wild,
Mm.
right? So there's other things we've seen. We've seen models solving for the wrong parameters, right? So this goes back to transparency and accountability.
Right.
There was a hospital system that was doing research into when to do medical intervention with their patients. Here's the thing: to make these models successful, you have to put tons of data in them, right? So sometimes you put more data than you should because you're trying to lean into the more data I put in, the better. Well, kind of like the way we talked about with zip codes being proxies for racism. Sometimes zip codes, when they're introduced in the healthcare field, will say, "Oh, this the case that I'm referencing, the model started solving for the way patients would actually show up to their appointments and their zip code." Now, the people putting the model together did not ask the model to do that.
Ah,
But models are data hungry.
ah,
Models will take all the data because the model's job is to give you an answer and the best answer it can. It doesn't make any judgment. It doesn't understand that there's judgment involved in the decisions. It's a machine.
mhm.
So they had put in all the data they could, and what was happening is medical intervention was happening slower with one patient group over another because the model has started to include I can't remember what the exact term it was, but it's how often a patient does not show up
Wow.
to their
No
appointment.
shows. Wow.
Yes.
Okay.
So when they noticed, when the researchers noticed that luckily this was not live, this was not on a population, this was just doing predictive modeling on when medical intervention should happen. I think it was with diabetes patients
Mm.
when they needed specific types of medical intervention.
Mhm.
And it was pushing out one on certain populations because when they dug deep and said, why are these different? They
Right.
realized that the model had used a separate piece of data that they had not insisted
Wow.
that it use.
Wow.
So this is why accountability, transparency is so important.
And that
Um,
verifying, right? And just verifying,
yeah, oh,
checking,
absolutely.
because people are blindly
Absolutely.
trusting it.
Absolutely. And the last one that I'll talk about is one of my favorites. So um, here's the thing. Healthcare is some of the most important
Mhm.
and some of the most difficult systems in the
Mhm.
world. And
Mhm.
it impacts us every day,
Right.
right? So the bar is so high on what you're trying to do and what you're trying to deliver.
Right.
So when there are struggles, sometimes AI is not the answer,
Right.
right? But because we're trying to increase efficiencies, because we're trying to do all these things, we want to rush to put that technology in place. So sometimes there is not enough investment made into systems, right? Sometimes the investment into system lags behind. So some of our friends in healthcare are stuck with older versions of software, older versions of computers that maybe aren't the most modern and that maybe have some issues. Now, some of the problems that I've seen is that in the rush to try to make a better experience, instead of fixing the problems of we need to update our software and we need to update our systems, people are trying to introduce AI into the system to introduce some efficiencies, but that will never make up for the broken system
Right.
at the foundation,
Mm.
right? So people want to use these systems that record conversations and that take notes for the doctor. Well, you absolutely can use those, but you have to do so much due diligence before you put those in place. So I think my warning is do your due diligence, understand, ask the questions. Where is my data going? If someone is telling you, oh, no one's getting your data, you need to verify that because your data is the most highly regulated and highly protected data that exists, right, in the world. So
Mhm.
making sure that instead of trying to just fix the problem right in front of you, it's harder, but fixing the underlying issues to make your systems better. So therefore you don't have to put a band-aid in place.
Right.
Using AI and an advanced system like AI as a band-aid is just, it's never going to work,
Right.
because at the bottom, your systems need to be in place. Your data needs to be managed, right? And never just try these systems without getting the buy-in from your administrators, from your IT people. I know every hospital runs a little bit different.
Yeah.
Every healthcare system works a little bit different, but I highly recommend sitting down with your providers, sitting down with your CIOs, your CTOs, your IT guy at the hospital, and saying, what can I use, right? Because it needs to work within your system. Putting in something to try to do as a band-aid and not truly understanding, because here's the thing, if the doctors, the nurses, the people that are actually doing patient work had to sit down and understand all these details of technology, they would never get their work done,
Right.
right?
Right.
So it's like you already have so much that you have to do, truly working in partnership with your technology professionals to understand what's available, and then suggesting, hey, we'd love to see something that does this. Like, is there a solution? And we can do that. So I know everyone wants to solve these problems, and AI is sexy. Everyone wants to use it,
Ah,
but it's not the answer to all of the
right.
problems,
Right. So
unfortunately.
have to collaborate, and you should definitely be
Yeah,
collaborating with your IT group. So what
yeah,
about
absolutely.
AI strategy? And is that part
Yeah,
of what you're doing in your day-to-day job with the Cantellus
yeah,
Group? Is that what you
yeah,
your
absolutely.
clients?
So, so AI strategy is kind of a holistic look. Some people call it governance, but when you put the governance word in, everyone gets a little bit afraid because they think that governance is just all about rules that don't let you do anything fun.
Mm,
But the way we look at it, so AI strategy, it's kind of a follow on for your data strategy, right? So
okay.
you put your data strategy together and you say, this is how we protect our data. This is how it's used. This is what we use it for. This is what it's not used for, right? And put those parameters around it. So AI strategy is basically how you holistically look at your organization and say, where can we get the benefits from AI?
Mm,
And where is it off limits? So where we do use it, and then where we do not use it. And that also goes into your systems, right? It has to align with your IT strategy, with your data strategy, and then how you use AI. Because to truly adopt AI and get the business benefits, everyone has to be aligned, from the data scientists and the data collectors that collect your data to your C-suite, to your administrators, so they understand how AI is being used.
yeah.
So the way we approach it is very holistically, and we always include some sort of change management or some sort of communication strategy, because you have to be not only transparent with your systems and your regulators, you need to be transparent with your employees. And so they understand how you're using it, so they understand how it can help them in their jobs. We talked about, some very basic use cases for it to enhance efficiencies, like taking meeting notes, especially if they're just your internal meetings,
Mhm.
meeting notes, action items, sending it to everyone on the meeting immediately after. I mean, that takes some vital time off people's calendars to be able to do that. Scheduling, all of those things that I mean, I know in my early days as a consultant, sometimes it would take me a full day to schedule all the meetings that we needed, because you had calendars everywhere, you had people everywhere, time zones, and there's systems now that can do that easily. And then that's what I love about these little like hacks is, and these little internal things that you can do, is it frees you up to do the thinking around your strategy, right? What do I want to really do with AI? What
Yeah.
do we really want to do to set up our organization for the next time? So we truly believe that if you set a good foundation for AI, the next technology that comes through, you can use that same foundation, right? You're setting up a foundation just like a house,
Yeah.
right? You can't build a good house if you don't have a solid foundation. So once you have your AI strategy in place, you can replicate those same principles that you did for AI with quantum or whatever technology is coming around the corner.
And just to clarify, Rebecca, you typically work with very large organizations. Like what kind of organizations? I don't want like a student calling you or
No, yeah, we do usually work with large systems. We work with non-governmental as well as governmental organizations, and then we work with large enterprises as well.
okay, perfect. And then just to wrap up, earlier when we started talking before I hit record, we were talking about some of the regulatory agencies that have now come up
Yes.
with AI. Can you tell us a little bit about that?
Yeah, absolutely. So each country is handling AI and AI regulations a little bit differently. So the first regulation that's coming, and of course, healthcare highly regulated industry, so no one's surprised by this. The first regulation that's coming is the EU AI Act. It's already been passed here in the European Union, and it will impact multinational companies. So if you are a company or a healthcare system that goes across borders, if you're a healthcare insurer that has, clients all over the world, you have to pay attention to these to this regulation. And the easiest way to explain the EU AI Act is it takes these use cases, like we were talking about,
Mhm.
and it prioritizes them into high risk and low risk. And basically, it says at the highest risk, like real-time systems making decisions about people's healthcare, that is not allowed. Like you will not be able to ever use those use cases in the European Union.
Okay.
Some low risk cases, like you using AI on your internal systems to create efficiencies, they're like you can use that all day long. So they do it in how high of a risk it creates for the public. Now, the United States is doing it a little bit differently. There is currently no federal AI Act. President Biden has put out an executive order that the NIST, the National Institute of Science and Technology, is putting some organizational things around. We are in one of their their governing groups to help them kind of decide what the framework is going to look like. But right now, there's no regulation. However, there's about 30 states looking at AI regulations. So these things are moving every day. But in July, the Department of Health and Human Services did publish, sorry, my hair got in my way, did publish a rules around AI applications in healthcare specifically. And the key point, and then I'll get you the links to all these so you can share them. But the key point about Health and Human Services, it's about discrimination and the bias that we talked about that can be in these systems. And basically, it requires all healthcare providers to evaluate and monitor their AI systems to check for bias and discrimination. So that's what we were talking about, that transparency and that accountability. They are putting it into rules and into guidelines to tell healthcare providers, if you're going to use AI, you must be monitoring these systems. Now, there's technology systems that can do it. Having humans involved in the thing is another great way to do it. There's lots of different tools, but this is the first thing for specifically around healthcare to come out from the US government that will impact people's actual jobs. Right. And then finally, I wanted to mention that the OECD, which is an international governance body, they did one of the first responsible AI frameworks. They have issued, they're working on a paper. It's not been finalized yet, but it is issued. It's called their Collective Action for Responsible AI in Health. And I found it to be super useful. It's very practical. It's about 30 pages. You can download it online. The OECD gives all their frameworks out for free to help organizations start their practices around this. And it's a great document that gives you some really practical applications and how to be responsible with the data and the importance of the data that is in healthcare.
Awesome. All right. Well, thank you so much, Rebecca, for your time.
Pleasure.
So much more than I had anticipated.
Thank you.
We'll chat with you soon. Thank you so much for your time.
My pleasure. Thank you so much for having me.
Thank you.